Wonderful to be here this morning, and thank you for the invitation, Steph, Ben and Roland, and welcome, and it's lovely to see you again as well. It's a beautiful day, regardless of the rain. Rain is here for purpose, to feed the animals, the land, and give us water. So my name is Cheryl Smith. It's my cousin Raymond Smith. My father was Uncle Bill Smith, who was a very well-known Aboriginal elder throughout our community and the wider community. And also my father also travelled overseas to talk about our environment and the way how Aboriginal people who lived here in our cultural ways and our food and also spiritual side of culture. And he went all over Rio de Janeiro and Hawaii, Switzerland, Geneva, different places all over the world to talk about Australia and the Indigenous people of this country. And I'm just going to, yes, I'll also mention about my father and my brother's father as well. They're two brothers. My father and Raymond's father are brothers. And they started off the Awabakal Limited many years ago. And how the place is built up to where it is today is just amazing. And it's all through the work and people coming together and wanting to make a better place here for our people and understanding of our ways and connections with one another and sharing. But I'm just going to say Wanda Kalua, Anakanya, Yama, Maraba, Barawaguyu, God Almighty, great creator. This land we stand on this morning is the traditional owners of the Awabakal and Warramai people. And I also pay respects to our elders, past and present. And I also pay respects to each and every one of you here this morning as well, because we walk this land together, hand in hand. We're connected spiritually to this land. And our people, we don't own the land owns us and nurtures us in each and every way. And it's the same with you as well, because we are a part of this country. So this morning, I'm just going to sing a song that I wrote many years ago. It's about coming together and being proud of who you are. Follow your dreams, climb that mountain, fly with that eagle, and just be who you are and believe in what you're doing is right and to make this place a better place. It's time to come together. It's time to put our things aside. It's time to become one people and join our spirits with pride. Listen to the dream time. Listen to the old ones say, we are from the dust and molded from the clay. Be proud of who you are and hold your heads up high. Look to the sky, try not to cry. Be proud of who you are and hold your heads up high. Look to the sky and try not to cry. Try not to cry. Try not to cry. Listen to the wind. Hear the words go by. The voices of our people say one spirit, one body, one mind. Join this sacred land that God gave to each Aboriginal man. It's time to come together, walking hand in hand. Be proud of who you are and hold your heads up high. Look to the sky. Try not to cry. Or be proud of who you are. And hold your heads up high. Look to the sky and try not to cry. Try not to cry. Try not to cry. Thank you. Have a successful meeting, and hope all goes well today for you all. Have a wonderful day. Thank you.
Let's thank Auntie Cheryl and Uncle Ray one more time. They really do the best welcome to country. So they just, it's incredible. Every time we have them along, it's something different and something new and something engaging and uplifting. Welcome everyone. I'm Ramsey Awad. I'm the Executive Director of Infrastructure, Planning and most importantly, Sustainability for Hunter New England Health. And we're really proud to have been partnering with a whole raft of groups today to make this event happen. It is the 11th Greening Healthcare Sector Forum, and we have a number of people here, and I think there's a lot more people joining us during the day. We surprisingly have over, I think, 250 people online joining us, which is difficult to get used to, but just sort of wave to the camera every so often, it'll be okay. Today's theme, driving systems change for sustainable healthcare. And for all of us that work in the bureaucracy, which is healthcare, is a really important topic because a lot of our clinicians develop ideas, sustainable ideas in their areas of expertise, but it is incredibly hard to take those ideas forward, to grow them in a bureaucracy, to embed them and ensure that those ideas are actually sustainable and continue. So today's theme is really relevant, and hopefully all of us will come away with some ideas that we can take back to our work environment. Now, I have a little housekeeping as always, which is always a bit boring for me, but I'll do it anyway. You can ask questions during the day. We've got Slido, and you can list questions whether you're in the audience or online, and you can upvote. I don't know what upvoting means, but I think it means you can pick questions which you like, and there'll be a panel afterwards at the end of each session which can answer those questions as we progress. We also have some sponsor exhibitions in the foyer. There's 12 posters up there. So in the break, please wander through and have a look. For our online attendees, there's going to be a Zoom networking session in the break at lunchtime. And there's also a virtual hub, and there's also a chat function. So if you want to connect online, you absolutely can. For everyone that's here, we have the toilets are around the back, sort of behind this wall. There is a water station donated by Hunter Water, all recycled water. It's not really, is it? I'm not sure. I just thought I'd throw that in. It's donated by Hunter Water, but in collaboration with Warramai artist Tyson Jolie. Now, I want to read this so I get it right. Tyson's artwork helps us reflect on cultural connections to water. His work, Our Gration, signifying all of us, people, animals and biology, and the many different paths we all take to flow towards a common place. Exits are at the back. Tonight, I understand there's some informal drinks and dinner down at the Duke Hotel, which is just down in Lambton from 6 p.m. Now, I need a little pointer, I think. Is there one? Oh, you have it. Thank you. So that's how you join Slido. I hope you're all getting me in the photo as well. Our sponsors are incredibly important. We have two major sponsors today, Matt McDonald and Multiplex, who have come on board with today's forum. And Multiplex, if you don't know, is constructing the new facility here, the John Hunter Health and Innovation Precinct. So really grateful for their participation today. Now, we also have this being tweeted by Croaky, and the forum's going to be recorded and sent to all the participants as well. Now, let's get this thing going and started. I want to introduce Michael D'Arienzo. Michael is the Chief Executive of Hunter New England Health. For those of you who aren't part of Hunter New England Health, Hunter New England Health is the biggest health district in New South Wales. It is double the size of all the Sydney groups, which we like to gloat about. It is double the size because we have a large metropolitan area, being Newcastle and Lake Macquarie, but we also have a huge rural area in the Hunter and New England. It is an enormous organisation, and Michael has been at the forefront in driving sustainability within our organisation, which has made us a leader in Australia. And I'd like to welcome Michael, and please make him feel welcome also. Thank you.
Just rest the piece of the paper on here. That's okay. Okay. Well, thank you very much, Ramsey. Thank you very much. Well, firstly, I'd like to acknowledge Aboriginal and Torres Strait Islander people as the traditional owners of Australia and custodians of the oldest continuous culture in the world. And also I pay my respect to elders past, present and emerging. And again, thank you everybody for coming here today. And it is lovely, the sun is shining, which is great to see. Look, I'm delighted to welcome you to the forum, and I would like to thank Global Green and Healthy Hospitals and Climate and Health Alliance for putting together this event, along, of course, with thanking HMRI for hosting it today. So again, thank you to everybody. I want to start by acknowledging the seriousness of climate change and the role that the health sector has in reducing environmental impact. I think for too long, health has sort of stood by and watched and not taken an active lead. And as Ramsey has pointed out, we are the largest district in New South Wales with a footprint the size of England. So we have a duty of care to our environment. We also have a duty of care to our patients and community. So it's fantastic that we're taking the lead. And I think there's a lot of what we've been doing has influenced New South Wales and influenced across Australia. And I think that's what leadership is all about. So I thank everybody for the efforts they're putting in there. Look, we're already seeing climate change impact the health of individuals in several ways, from extreme weather events, we're seeing plenty of that, to the disruption of food systems. It's also undermining many of the social determinants of good health, such as equity and access to healthcare and social support structures. I think we've forgotten about that, which is a lot of the focus through the health sector, and I hope we continue to do that. It's also important that as a sector, we're not inadvertently harming health in our efforts to protect and improve it. That's why, as a local health district, we're committed to becoming carbon and waste neutral by 2030. It's an ambitious target. I remember when Ramsey I said, it is ambitious, but like anything, you have to be ambitious to achieve the sort of change that we're trying to achieve. It's one that does require coordination, accountable targets for reducing our footprint, and behavioural change amongst colleagues at all levels. We started this journey in 2020 with 6 key focus areas: waste, water, energy, transport, infrastructure and procurement. What I can say is since this time, we have reduced our environmental impact while adopting Aboriginal stewardship values and caring for country, engaging and empowering staff, and actively working with our partners and the local communities where we operate. And I think that really has been the foundation of a lot of our success. Now, in just 1 year, we've smashed all but one of our key targets. Pleasingly, we've reduced our CO2 emissions by 17%. We've reused 19% of rainwater captured. We've recycled 9% of our water consumption, and we've diverted 12% of waste from landfill. I think that's not a bad effort in a short period of time. Adding to that, we've launched the largest solar panel system of any hospital here on the John Hunter campus in the world. We've implemented reverse osmosis at Tamworth, Inverell and Maitland hospitals. We've launched salary sacrificing for e-bikes to get people off the road and get them here. And of course, we've initiated new recycling streams for simple things like IV bags, baby bottles, needle caps, copper, metal, as well as batteries. So you can see some simple things can lead to sustainable change. And again, that's just the start of what we're doing. And I'm hopefully today we'll hear more about what we can all do in this space. Look, these achievements wouldn't be possible without the support and the commitment of our staff and teams across the district, who have a real passion and willingness to invest their time, energy to help us achieve these goals. And truly, it had really been a team effort. The whole 18,000 staff at Hunter New England are fully committed and passionate. The amount of emails I get, the amount of people who tap me on the shoulder and say, we need to do more is fantastic. While there's a lot more work to be done, we're well on the way of building a healthy legacy for generations to come, which is really important. And again, this is a truly remarkable forum. I'm hopeful the discussions throughout the day will provide plenty of opportunities to drive the change that we require in the healthcare system and sector. And again, congratulations to organisers, congratulations to everybody involved, and I hope you have a lovely day. Thank you.
Thank you so much, Michael. And Michael gave you a taste of some of the initiatives that we've been leading here at Hunter New England, and not only just to promote my own talk, but I'll be speaking this afternoon about how we've driven that through our very large and complicated organisation. I realised that I made a mistake earlier and I didn't thank everyone, but I wanted to go back on a couple of slides and just acknowledge some of our exhibition sponsors and partners on the board there. They may withdraw their funding if I don't, so here they are. And again, thank you to those groups. Now, we have some speakers. Now, I'd love to say that a few of these are recorded because of our sustainability values, but I think we just couldn't afford to fly them out here, I don't think. But no, it's not true at all. But we've got some great speakers that are going to come forward now. The first is our Federal Minister for Health and Aged Care, Minister Mark Butler. We have a recorded message from him, which we're going to play in a moment. And following that, we're going to hear from our keynote speakers, and I'll give a brief introduction of those speakers in a moment. Thanks. Anyone know any good jokes? Oh, here we go.
Ngunnawal people, so I offer my respect to their elders, past, present and emerging. I extend that same respect to the traditional owners of the lands on which you're joining us today. If we look back 12 years, when a past Labor government was in power, the Lancet publication declared climate change the biggest global health threat of the 21st century. Reflecting on the intervening years, much has changed in the world, but that global health threat has not received the attention it fully deserves. You only need to look over the past 2 years to see that Australia has faced challenges the experts have been telling us will increase due to the changing climate. Bushfires and smoke pollution, heat waves, storms and floods, and the spread of insect-borne diseases like Japanese encephalitis. I also know that many of you joining the forum today are currently dealing with flooding and the threat of floods in your own communities. I appreciate your commitment to this work in the face of disaster, knowing that the work we do now may protect many more communities in years to come. Let there be no mistake, we recognise the enormous threat to the safety and well-being of Australian communities posed by climate change, and we will act. The Albanese government is making climate change a national health priority. My department and I will take a leadership role, working with the states and territories and other stakeholders to better prepare the health system for the impacts of climate change. We'll develop Australia's first national health and climate strategy, informed by evidence and research. That strategy aims to reduce the carbon footprint of the health sector, to ensure that the health sector is well prepared for the impacts of climate change, and to maximise the synergies between good climate policy and good public health policy. It's also our intention to set Australia on a path to reduce the carbon footprint of the health sector. Health in Australia contributes approximately 7% of our emissions as a country, which is not a trivial amount. Reducing health system emissions must be a factor in our future planning. The leadership of the Climate and Health Alliance in developing a strategic agenda to both address the health impacts of climate change and reduce the carbon footprint of the health sector is really commendable. Other groups such as Doctors for the Environment, the AMA, the Royal College of Physicians and other medical colleges are also acting on climate change and health. Reports, strategies and recommendations are already out there, establishing a solid foundation for future action. Our government will put the expertise and hard work which has already been done to fast track the development of the strategy so that we can quickly shift our collective focus towards that action. I'm aware of the critical work being done here and abroad to transform health systems to be more climate resilient and low carbon, particularly under the banner of the Alliance for Transformative Action on Climate Change and Health. State and territory governments, peak bodies and other non-government organisations also have work underway, but it must continue and it must gain pace. Later today, health institutions will share with this forum their learnings on decarbonisation, building resilience and sustainability, and I commend those organisations. But I'd especially like to mention the Hunter New England Local Health District as co-host today and for their commitment to being carbon and waste neutral by 2030. Certain population groups such as First Nations people, rural and regional populations, people with existing chronic illness, migrants and people living in low socioeconomic areas bear the brunt of climate change. These groups are also more vulnerable to experiencing the physical and mental health impacts of that climate change. The Albanese government is listening to the experts. We're prepared to act where others haven't, and we recognise that the health of our world and our land is intrinsically linked to the health of our people, and that we must strive for success in addressing both, for our health, for our children, and for all future generations. I really wish you well for the rest of your forum. Thank you very much.
I don't think we have to clap, he won't hear it, but it's, look, we're apolitical, but it is great to get alignment with our federal government, and our state government is making some movements with the things that we're interested in, and hopefully we'll see some more movement and more traction and some more policy change, which is desperately needed sometimes to embed these things. Okay, onwards. We have our keynote address. We've got two people speaking to us today. So Dr. David Pension and Sonia Roshnik. I'm going to read their biographies for you, so you've got a sense of who's speaking to us. But for those of us who play in the sustainability space, I'm sure you've come across David and Sonia previously. So Sonia has over 30 years experience in health and social care internationally as a clinician, in senior hospital management and in sustainability. In her previous role as Director of the Sustainable Development Unit in the UK for NHS, Sonia launched the Greener NHS program, including a commitment to net zero climate emissions. So Sonia's played in this space for a long time, and we've got a lot to learn from Sonia. And David Pension is a UK trained doctor and was the founding director of Sustainable Development Unit for the NHS and Public Health in England. He is now an honorary professor and an associate at the Medical and Health School at the University of Exeter. And following their address, we've got a couple of great panelists here who, Tony and Angie, who I'll introduce, who are going to give us their reflections on that keynote address, and there'll be an opportunity for all of us to ask some questions.
So, welcome everybody. Thank you very much for inviting both of us. We'll introduce ourselves shortly. My name is David Pension. With my colleague here, Sonia, we on and off for 10 years started the Sustainable Development Unit for the NHS in England, and latterly for the NHS and Public Health England. And I now work elsewhere, as does Sonia. I actually work in the University of Exeter in the medical school. So I'll just briefly hand over to my colleague Sonia, who will tell you a little bit about herself too.
Hello, yes, so I'm Sonia Roshnik. I'm delighted to be with you and to do this session with David. We're sorry that we can't be with you in Australia, but this is second best maybe. And yes, I also worked for the Sustainable Development Unit for a long period, and then did a stint with Healthcare Without Harm as Climate Policy Director, and now I'm setting up the Geneva Sustainability Centre, which is part of the International Hospital Federation.
Great, thanks very much. So what we'll do is we'll chat with each other as naturally and as validly and as accurately as we can in the next few minutes. And we hope that you'll find this useful, and we'll try and frame the conversation accordingly. But also, if things arise which you want to tunnel down into a bit more deeply, or you want to comment on, I'm sure there'll be opportunities for you either in the chat box. And I think that we'd be delighted to take emails afterwards if there is something that's really burning that you want to take up with us. So I'll kick off and ask Sonia a sort of starter for 10 really, which is, although we looked as though we had a strategy and we looked as though we were organized, we were actually over the years we sort of led the unit on behalf of the NHS. But I suspect there are some things we were really glad we did by luck or design. And I wonder, Sonia, if you could just reflect on some of the things that really were worth reflecting on and learning from and sharing now, because I suspect some of those lessons are as valid today as they ever have been.
Yeah, thank you. I mean, I guess when we first started, I remember the context was quite different, and it was a little bit harder to engage with people on the topic. And a lot of people were still quite skeptical about what climate change really meant. We were lucky because there was the Climate Change Act that had been put in place in the UK, and the NHS had decided that it needed to do something about it. And when we were faced with this sort of thing about, so how on earth do you get started? We thought a carbon footprint might be a good place. And one of the things I am so grateful we did when we started off with the carbon footprint was that we decided to do a carbon footprint of all the things that the NHS influences. And that is exceedingly important because it really takes it into the realms of a system-wide transformation, because you're looking at not just the buildings or the energy, but you're also looking at the products and the way services are run. And in fact, it took us down all sorts of interesting avenues, because we found out that pharmaceuticals was huge, even if some people didn't like that answer. And that medical devices, there were a lot of things within healthcare that were specific to healthcare that contributed to this carbon footprint. And if we'd only done a scope 1 or scope 2 carbon footprint, we would have stuck very much to just green buildings, and that we would have done the whole topic a misjustice. So
yes, that's interesting. I mean, my memory of that is very similar, and I think one of the issues I think we spent about a quarter of our very small budget on research in the early days, and I think that issue that Sonia refers to there about generating some oh my goodness facts so that people will think, you know, gosh, this is really important, this is really big, this is, you know, potentially addressable, and it's central to the way the healthcare system works, is very important. You said a little bit about engagement there, Sonia. Do you want to expand a little bit about on how we tended to engage with people? Because we were dealing with a very diverse population of, and although this was predominantly the health and care system, there was a huge diversity of people and responsibilities and values therein. So do you want to say a little bit more about our engagement tactics?
yeah, I mean, and I think these are still very relevant today, that you can only take people on a journey or work with people on a journey if you know where they're at to start off with. And that really implies understanding what their perception is, where they're at on the journey, and maybe what might be the points of influence or the points of entry, we sometimes call them. And what we found is that people had very different ways of engaging with the topic. And sometimes the words climate change weren't the favorite ones, that we used other mechanisms for engaging and discussing things with people. I think the words climate change and the fact that the climate crisis and health crisis is much more recognized now, so that may be less of an issue. But the concept that people may be at different points on the journey, may have different levels of understanding, and that if you would want to work with them, it really requires a little bit of starting in their shoes rather than just blurting out what you know.
Yes, I think that's true. It was a big learning for me that I come from a background of being slightly preachy and soapboxy about this whole issue. And I very quickly, I think, learned from many people that this wasn't a particularly productive thing to do. And in a sense, as you know, we're both ex-clinicians in a sense, we should have known, well, I should have known better that, you know, that old adage that if you listen to your patient long enough, they'll tell you what's wrong with them. But I wasn't applying that in this situation, but hopefully we did. I certainly changed quite a lot in terms of listening to people about those so-called entry points, in terms of, you don't want to break the law, you don't want to break the bank, you don't want to break your social contract with the people you purport to serve. So there are a huge number of different ways of which coming to this issue. So, and I think the lesson for me was you've got to try and combine the diversity of approaches into one core vision, one golden thread, however we called it, rather than something which I still spot a lot and worries me a lot, which is a lot of people who are equally concerned about the ecological crisis, essentially saying my part of the crisis is more important than your part of the crisis. And that's tremendously sad, really, because I think we all have a lot more in common in this journey than we do in terms of our differences.
I agree. So, David, if I put the question back to you, what do you think were some of the key points on our Sustainable Development Unit journey that you remember well or think are particularly key?
Well, I mean, one of the things, it sounds so obvious, but it's obvious now. It wasn't obvious then. I mean, initially, I always talked about this issue as a sort of ecological crisis or a climate crisis or a nature crisis. But of course, I should have stumbled onto the fact this is a health crisis, talking about it in a language with words that made sense, that were real to the people who we were trying to help or facilitate or accelerate or whatever. So that was one of the first things. The second was that I thought that there were some people, some professions who would be better at this than others. And I was completely wrong about that too, in terms of it was often people's values and the way they shared their values with other people, often quietly, persistently, meaningfully, relevantly, practically, that really mattered. And I think looking out into the NHS, it was very true that in a sense the future had already arrived, except it was very unevenly spread. There were huge areas, huge numbers of really great things going on. But people were so busy doing them, and they were very different things. They hadn't had a chance to sort of shout it out and say, why don't you try this? And I think that was one of our roles, which was to identify good practice and say to other people, you can do this if you like.
Yeah, I mean, I agree with that sometimes we worry, or I've found that people worry that you need to understand it fully before getting started. And I think one of the key messages is that there are so many actions that can be taken now in so many different directions. There's a lot of no regret measures. We do not need to dissect it fully or even have a perfect carbon footprint to get started. There's something about starting where you're at and then piecing all the different elements together, because I'm sure that in Australia you've got, well, I know you have lots of examples of great practice, and there's something about how you can shine the light on those and use those to embed it into the way things happen everywhere now. I think one of the things at the SGU, I don't know if you remember, David, but we were in a way collecting all these flowers in a field, and they all were a bit different, and they were all shining a different sense and a different way of looking at things. And that gradually the Sustainable Development Unit really tried to get it much more embedded into the structures of the NHS and the very decision-making processes. And I guess that's part of what we all need to do, is to pull these elements of good practice and use them to turn them into more systematic decision-making processes.
Yeah, that's very true. But I mean, one of the things I particularly remember when people were reluctant to move, and I think this especially applied to doctors, is I think we all look for excuses not to do things we think we ought to be able to do. That sounds very rude, but I think a lot of professionals are very technical, and they need to have this feeling. We have this feeling we need to understand everything before we can act, and of course that is a bit of a disaster in this area, because essentially we're surfing a wave. We've got to find the opportunities. We've got to create the opportunities. The world changes very quickly right in front of our eyes, and we've got to be able to grasp those opportunities, be it the crisis of COVID or the crisis of plastics or whatever it is, and incorporate it meaningfully into the collective narrative. So I think it's not about knowing exactly what to do and then doing it. It's about an evolving journey. And I know that things that you were very central to, Sonia, like the designing of the route map, maybe you could just talk a little bit about why having a route map was very, in a sense, very useful, but very comforting for people, to give them permission, to give them guidance, to know where they were on a particular journey.
Yeah, I mean, thank you. It's true that when we first started, we had done the carbon footprint and we'd started identifying actions, but we very quickly realized that this was going to be a long, drawn out transformational journey, and that we in the health sector, we're not great at thinking about the future or how we can influence it, or actually be part of creating a scenario that might be different to the one in which we're heading, steam on. So the roadmap was really about trying to identify some of the key elements that would need to happen across the system in order to get to a better place, to what a sustainable health system might look like. So we had identified aspects around engagement, be that with the public or with oneself as an individual, aspects around governance and standards, and then innovation, of course, and models of care, what might need to be transformatively different. And in this route map, we had identified what you might do at early stages, middle stages, and later stages. So very much recognizing that you could start at any point and then try and move across, just like you might be. I think we used to wonder whether they looked like lily pads on a pond that you were trying to move across on. But the concept that there is no one way to do this is quite important, but there are a number of different elements to try and weave together, and that we do need to think into the future is quite important. And I very much recall that we would laugh occasionally saying, well, in the NHS, the future is about 2 hours away.
Yeah, absolutely. Yeah, and thinking strategically was thinking about tomorrow. Yeah, absolutely. So can I just take you back to something you said a few minutes ago, Sonia, where you were talking about, you don't have to bang on about climate change. There's a lot we can talk about. We can frame this in many words, in many ways that are more relevant, less frightening. And one of the things I think we were called on to do a lot was about looking at leadership, how people led. And I remember we had these phrases like, well, leadership is at every level in every organization. It's not just about the people at the so-called top of the tree. So do you want to, perhaps you could say a few words about how we incorporated leadership development into our function?
Yes, I mean, of course, everybody's a leader at every level and can take forward great changes, and that's so important. But one of the things we did realize is that if the head of an organization did create the right environment for their staff to be able to lead in, it would make a huge difference in this space. And so we did recognize that board members, chief executives, non-executive directors had a key role to play in asking key questions and getting people to think about what it might mean for their organization. So we developed some board workshops, fundamentally, really, to try and start teasing out how this is climate change or environmental sustainability or sustainable health systems are actually very, very much aligned with where a health organization needs to go. And that it's by aligning it and by integrating it that you can create the right environment to move forward. And I think that still applies today. It's probably even more so today with the pandemic And the fact that there are so many different elements that leaders have to contend with, that trying to pull that all together so that it's not separate silos, but that they form a common vision and strategy is incredibly important. And I'm excited by the fact that the leaders of the future have got an incredible opportunity really to do things quite differently.
Yeah, no, that's good. That's great. I mean, that resonates very much with me too, in my memory of it all. I think those points about aligning it with other priorities of an organization or a clinical team or a ward or a hospital or a health center are very important. And it sort of reminds me of some of the issues we had when we were trying to engage people, when I was trying to engage people, especially at board level. I remember doing lots of board development days with various boards. And it was only until I think some of the key individuals found they could talk about this within their remit, within their scope, within their role, this is a quality of care issue, or this is a duty of care issue. So you're not taking people away from their core mission into this rather odd thing called the climate journey. You're bringing the climate journey into their role. And I think that was we were lucky that I was lucky I stumbled on that sort of better narrative for doing that.
And what makes it really relevant, I think, to me today is that actually, because the whole of this is accelerating and becoming even more important, there is something about really embarking on what that leadership journey looks like. And I think there are incredible opportunities to shape the future, to really create it in a different way. I was going to say we had the luxury of time. We obviously didn't have the luxury of time, but now things are, the requirement to really seriously address this is not questioned as much. And there is something about how you really get into systematic implementation. And that is an incredible opportunity. I find, I'm hoping that we can all support each other and learn from each other as we go forward.
Yeah, no, those are fine words. The issue about aligning and mainstreaming it is an important one. And I think in Australia, it's very important because I know a lot of people in both at a national and a state level in Australia are working very hard to establish sustainable development units or their equivalent. I mean, context has changed. It'll need different forms of engagement and metrics and what have you. But I think one of the things I remember we used to do evaluations occasionally with the people we used to work with, just to make sure that we were doing as much as we could, and accelerating and amplifying the things where we did add value and stop doing the things that weren't really very useful. I remember somebody once saying, all you need to do is exist, because existing gives me permission to mainstream this in my organization. So I think it's worthwhile, those of you who are worried in Australia about, for instance, the expense and complexity of setting up a unit. It needn't be complex and it needn't be expensive, actually. We were very rarely over about 5 full-time equivalents in the unit. This is for a staff of 1.3 million. So it being a catalytic, but embedded within the system enough that you understood how change happened, but sufficiently boutique or unique that you had a really important value added to what is high quality health and care for the system. It was
we were very much of the system for the system, and that was very important when it was set up. It wasn't part of the Department of Health. It was very much within the structures, and I think that was incredibly important, because we weren't we were with everyone trying to do this, not doing a purely top-down kind of approach.
Sure. So we've only got a few minutes left. I just wanted to ask you a final question, Sonia. A lot of people are often very willing and keen to act, but they will say, well, we need to get our own house in order first. We need to understand exactly what it is we need to do. We need to predict exactly what the effect is, the cost effectiveness of our actions. What sort of things do you say to people who want to be perfect before they put these things into practice?
Well, I mean, the future isn't perfect for one. We you know, we're all shaping it as we go along. And so it's better to get started on things that we know can make a difference. And all of us can get started in different places. But I do think that if you are one of those people who loves to measure and track, you know, make sure that you report it very publicly so that others are engaged on that journey with you. I would say that there's always a place where we can all start. And if you are hesitating, I would just look at your own sphere of influence in your own role and what it is that you touch upon where you can make a difference, because there's always ample opportunity, and we don't have to know whether it's X amount of carbon tons that will be saved immediately. That will come.
Yeah.
What about
absolutely.
you then, David? What would be your core message back?
Well, very similar to that, in fact. I mean, I think one of the core messages I would have that I hope would complement what you've just said, Sonia, is the fact that this can be a very lonely business in a very big system when we're all incredibly busy. But one of the things I did remember a lot was when people would phone me up from a hospital somewhere and said, "Oh, I'm the only person in XYZ hospital who takes this seriously." And I would look at, you know, the database or the people we worked with and think, well, there's so and so and so and so and so and so. And they said, gosh, I had no idea that chief exec or that finance director or that any statistician was equally concerned. So part of the journey is doing what Sonia just said, which was just go for it, get out on the dance floor, because you may be surprised by how many other people will think, oh gosh, well, if they're going to do it, I'm going to do it too. So that's incredibly important. So
that's a famous quote. We just need to mention it. You don't always need to know all the steps ahead of time. It's your willingness to engage with the music and step on the dance floor.
Yeah. So it is very important. And I think you have got sometimes to wear your heart on your sleeve and say, I don't know what to do. I don't know the best thing to do, but I care about this. And ask for help, because it's very unlikely people will see you nowadays as a crank. Not that I mean not that
well, if they do, it doesn't really matter.
It doesn't
actually.
matter. It's their problem, not ours. Anyway, I hope you've all found this very interesting and useful and entertaining or whatever. But if you do have any further questions, or if you'd like to pursue any of these points a little bit more, I'm sure Sonia or I would be very willing to receive your emails. And so good luck with the rest of the conference.
Yes, enjoy it, and hopefully see you another time.
Yeah.
Bye.
Okay, bye.
Good to speak to you.
So we're going to have some reflections on our keynote speakers. I want to introduce Professor Tony Cappin and Dr. Angie Bone. I'm going to read their biographies, but why don't you guys come up? Not only are they incredibly affable and kind, engaged people, but wonderfully knowledgeable in this space. So Tony asked me to keep the CV short, but I can't do that, Tony, because you're very impressive. So Tony directs the Monash Sustainable Development Institute and holds a chair of planetary health in the Monash School of Public Health and Preventative Medicine. A public health physician and authority in environmental health, his research focuses on urbanisation, sustainable development and human health. Welcome, Tony. And Angie is the Deputy Chief Health Officer in Victoria. Angie's main interest is in tackling social and environmental determinants of poor health, particularly in relation to high impact weather events and climate change through sustainable development, disaster risk protection or reduction, and appropriate preparedness, response and recovery. Who'd like to go first?
Yeah, shall I lead off?
Yes.
Yeah. Thanks very much, Ramsey, and terrific to be with you all here today in person. I know when we approached David Pension and Sonia, they were keen to be online, but the timing of the opening session just didn't work as well. So David certainly doesn't like to travel too much. It's part of his approach, and I think that's really important that we honour that too. But terrific to be here, particularly in the Hunter, where as has been said from the outset, there's been attention to these issues for some time. And I think that's relevant to the reflections from David and Sonia just now, is they referred to the importance of positional leadership. It's not all about positional leadership, but here in the Hunter, you've seen it on show already today. And I also saw down in the corner of the screen here, I saw that Lynn Frager is online with us today. And many of you would know that Lynn is a former chair of the board here in this health service. And she was one of those people, you know, asking pointed questions and helping to motivate action. And so, you know, Lynn is an established leader in agricultural injury, has been a particular focus. I've known Lynn for many years. And I think that relates to another point from what they said, that you can come at this no matter who you are, no matter what your position is in the system, you have a role to play. Let me pass though to Angie to make some other reflections, and then I'll come back, say a few more words, but we really are hoping that there'll still be, you know, 5 or 10 minutes at the end for any comments or questions from the people in the room here. I think it's going to be difficult for us to field them from online in this session, but we'd be delighted if there were a few questions or comments from the people in the room in this session. So over to you, Angie.
Thank you, and hello everybody. So I moved to Australia about 4.5 years ago, having previously worked in the UK. I was working in Public Health England, very closely with both David and Sonia. So collaborated with them, attended many of their leadership programs, were involved in lots of the kind of strategic work as well. And so, you know, my reflections will be partly from what they've just said, but also partly from the 12 years of working quite closely with them. And I think there's 3 main points that I'd probably bring out. One is about personal leadership. The second is about the power of the collective. And then the third thing is the importance of learning and sharing. So in terms of personal leadership, you know, I look at both David and Sonia, and for me, they're absolute role models of humility, of listening, of self-awareness, of self-care, of courage to challenge, and a way of permissioning others to challenge, to ask questions, to not just accept that the system is the way it is. But as they quite rightly say, they don't preach. They start from where the person that they're talking with is, and they look for those alignments. And so for me, they've been real role models at watching them do that and how effective that is. So, and then the second thing I wanted to talk about is that power of the collective. And I think, you know, David pulled this out about how lonely it can sometimes seem when you're working in this space, when you are trying to push at those edges, that the system that we have actually created as a society, it's not immutable, but sometimes we think it is. And there is something really valuable about that diversity of different opinions coming together for a common goal. And they would always encourage us to be working across disciplines, across different parts of the health sector, and different geographies as well, sharing that learning, and also giving ourselves, I guess, comfort that you're not the only voice out there. You're not the only person who thinks this way. And there was some real value in those 2-day leadership courses that they ran, of bringing together a group of about 30 people at various stages in their careers to look at these challenges and find solutions together. And so that leads me into that third thing about learning, that none of us are experts in this. None of us know really what we need to do in that detail, but that we have to act, and we have to act now. We know how urgent this situation is. And there is something really, really valuable in learning by doing. and then after you have done the doing, to be evaluating it, monitoring it as you go on, and sharing that learning with others so that you can share and celebrate your successes, and others can take those on, scale them up. But also you share your failures as well, so that people don't make the same mistakes that you have done. And I think putting those three things together then leads you into the space where you can start really thinking about system change, and influencing the institutional bigger picture system. And with that, I'm going to hand over back to Tony.
Right. Well, no, thanks, Angie. Really important reflections. And the only things that I might just add for additional emphasis are around the importance of integrating what we do into established systems and processes. And David and Sonia referred to that. And we don't want this to be another whole silo of effort. David referred to the fact that this is a quality of care issue, it's a duty of care issue, and we need to integrate it into the work we do. So perhaps we could open it up at this point for any questions or comments from the floor here.
Feel like Oprah. Here we go.
Could have just yelled it out. Thanks for your comments. I think they're really valid. You talked a lot about the collective and also that drive to make change within the healthcare sector. I think a lot of this change will have to come from industry and not traditional industry. So I think that's a bit of a barrier. Have you kind of workshopped that? Have you got some new players in that typically don't play in the healthcare space, but we will need that, particularly in Australia, where we've got logistical problems, we have lack of infrastructure, recycling's really hard here. So have you tackled any of that, or have you got any solutions? I can start.
Yeah, I'm not so aware about what's happening in Australia in this space, but I can tell you through connections with the NHS and the Greener NHS led by Nick Watts about how much emphasis they are putting on working with industry to change things. And you'll be aware of the various things that they've put in place for procurement in terms of standards. I think they've said that within the next 10 years, they're not going to procure from any industry that doesn't meet or exceed the NHS ambitions. And they've got at least 15 of those very big players, like AstraZeneca, like Pfizer, signed up to that. And I think there is real power for us in Australia to join that push. Now, you talked about other industries. I suspect you might be thinking about digital, etc. I don't know, but I know less about that, so I'm going to stop talking before I say something stupid and hand over to Tony.
Yeah, it certainly this can't be just done within the government systems. In a country like Australia, it's very much about engaging with industry, and here, even at this event. We've got key supporters of the event from the private sector. As Angie said, the procurement is so important. It was referred to in relation to what this district health service is paying attention to, and there within any of the industrial sectors, there are the early movers, the organisations, the companies that are already engaged. And many of these global companies, of course, in the work we do in healthcare. And we must remember that here in Australia, we have unfortunately been living in a bit of a bubble. In Europe, elsewhere around the world, people are at least a decade ahead. And while that's frustrating, it means we can catch up quickly because many of these global companies already have the kinds of policies that we will need to get moving more quickly. So we have to remain hopeful. And I think, I'm not a party political person. It was good to see what Mark Butler said just now. He's clearly well informed. He's a former climate change minister himself, of course. And I remember he was actually in this room about 3 years ago for a meeting of Doctors for Environment Australia. So I'm sure that if he wasn't so busy with other things, he would have tried to make the time to be here as well. It's not to say that the Labor Party is the saviour of all of this. I think all of the parties have been struggled with it, frankly, and we just have to keep trying to move together as a community for future generations, but also for people currently in the world. So, yeah. Any other comments or reflections before we break for tea? Because we've just got a couple of minutes
We've got a couple
left.
more questions.
Oh, good. Okay.
Hello, I'm a paediatric intensive care registered nurse. I was just wondering if you had any key pieces of advice in terms of empowering clinicians on the floor to be engaged. I find working in such a high acuity area, it's often a last priority, or you sort of get labelled as the doomsday, the world's going to end employee. So just struggling in how to boost morale whilst also acknowledging our high acuity, frankly, underpay and poor ratios.
Yeah, no, thanks for this. It's really important. I think it is important to find your people in the organisation. As David said, in any organisation, there's likely to be others who share your concerns and want to do more. Also, Nick Watts was here recently with us in Australia, and one of the things that he referred to was the importance of this ending up in people's position statements. So what they've done in the NHS now, every single employee of the National Health Service has in their position statement that the carbon footprint, the environmental footprint of healthcare is part of everybody's responsibility. Now, we're not there yet. Maybe Hunter could be the first one to be inserting that into everybody's position statement, because it's relevant to everybody across the whole service. And that gives the permission for people to engage in an appropriate way, given their context.
We've got a nod from our chief executive there, so I'll be making an announcement later. There was another question here, I believe.
Hi, I'm a scrub scout nurse and I generate a lot of waste. I'm just concerned about incineration. There been a lot of talks about the benefits of it, but I'm wondering what's happening in Europe. I heard that Europe's starting to move away from it, and maybe can you tell us, is that true? Or?
I can't. That would be the quick answer. I can't, but I can try and find out for you if that would be helpful, because it's been some time since I was there, and incineration was not something that was kind of definitely part of my remit. So I don't know if there are others here who have any further to add. There's somebody there who might have something to add.
Would you pass the mic back to the right people?
Yeah, just a quick point on what Denmark's done recently. Is their major power production in Copenhagen was redeveloped, and that's solely based on incineration with zero emissions being released. They've got some kind of technology that captures whatever's produced. So that's what Denmark's done. They also put a ski slope on it and a rock climbing wall.
We've got time for one more question. How's that? We don't mind inviting you to our meeting a little bit. Yeah, no problem.
Hey, David and Sonia talked a bit about innovation in a space where there's no clear answer. I was wondering if you guys have any insights into how to balance that with the funding envelope in government agencies.
Yeah, that's a really challenging but important question. because we have to innovate. We know that we have to innovate, and people have to be able to take risks, and we have to be able to fail occasionally. And that's quite challenging for people, particularly for government's funding. I think there is what I've seen from the UK is that they've created dedicated funds to be able to innovate. So there's an example from Nick Watts where they've got a relatively small amount of money where they've put out a call across the NHS for clinicians and others to do innovative projects, even if it's only £5,000 to do innovative projects, to try things. And they've had huge take up from that. I think they were expecting about 300 applicants over three weeks. They got 17,000. So there's this huge desire to do this, but it does need some dedicated funding. And I know that some of the other jurisdictions and ourselves in Victoria, we're looking at what could we do in terms of those quite small grants to innovate, to evaluate, and then share, and then enable that scaling up to be done. The other thing that I'm aware of, which I think is a great model to follow, is where you have a specialist, either a medical specialist or allied health professional or nursing specialist, taking a year out of their training or a day out of their week to focus entirely on greener ways of practice. And that's another way of doing that, but that also equally needs funding.
I don't have anything to add.
Can we thank Tony and Angie? Now, we've got gifts for all our speakers today. Is that right? Okay, so I've got to tell you where the gifts are coming from. They're coming from Bush Balm Social Enterprise, which is run by one of our members for the Global Greening members, called Purple House. Now, Purple House is an innovative Indigenous owned and operated health service based in Alice Springs in the Northern Territory. They provide employment opportunities for patients and their families and no-cost bush medicine for patients year-round. And they have generously donated the gifts for each of our speakers, which I guess we'll give you later. We are breaking for morning tea. If everyone could be back by 10:45. Thank you. That's our morning session. Thank you.